When you're sent to the radiology department at the hospital, the assumption is that you're expecting to get a more detailed or confirmed diagnosis of your condition or ailment. This form of radiology is diagnostic, but the imaging department at the KHMH also offers a more modern treatment called interventional radiology.
Diagnostic radiology, it involves using many diagnostic imaging modalities to diagnose disease, whether it be X-rays, CT scan, ultrasound. Now, interventional radiology, we don't only diagnose certain conditions, but we actually treat using imaging.
Dr. Barnaby Carrillo is the head of the radiology unit. He started his career at the KHMH in 2006. He left a few years later to specialize in radiology and then left once again to further study the subspecialty of interventional radiology. For the past 2 years, he has been able to provide this treatment to Belizeans.
What we use is radiology imaging. So like in this case, what we use is ultrasound together with X-ray.
Okay.
X-ray video or fluoroscopy, right?
Okay.
Fluoroscopy is like X-ray, but it's actually a video. Here at the KHMH, we have the ultrasound, we have the CT, because I use CT to do procedures also. And we have the fluoroscopy, so we have all of them. The only thing we need is the material. We actually use the wires, the catheters, which we get here, no? to perform those types of minimally invasive surgeries. For example, in patients with bleeding, gastrointestinal bleeding, let's say a patient came, he had bleeding, the gastroenterologist actually went in to try to detect where it was bleeding from, but sometimes there is so much blood that they can't see where the bleeding site is from, right? So by using interventional radiology, what we do is we access the arterial system. I use ultrasound for that also, access an artery in the groin area. We go into the major vessels that supply the bowel. We inject dye, and we can actually see where the blood is coming from. And after that, we use certain particles, to inject, and we stop the bleeding. The advantages that this has is less pain for the patient. There is no cost to that, right? Less pain to the patient. Recovery time is fast. Many of the procedures that I do is outpatient, and some of them just stay for an overnight. So it saves in terms of hospital staying. And the other advantage is for many of them we don't use general anesthesia. We just use local anesthesia.
So that cuts a lot of the cost.
Yeah, and recovery time, let's say a patient can go back to work in less time than with open surgery.
Carrillo works closely with other specialists at the KHMH, and they jointly decide if interventional radiology can be an option for treatment.
In some cases it will be open surgery, and in some cases it will be doing interventional surgery. Right?
Yeah. What's been the predominant condition that you have been working with so far?
One of the things that I do here the most is actually not to treat. This is not to treat, but very important as well, is doing biopsies. We take samples from any part of the body without surgery, right? I use, for example, if someone would have a tumor in the lung, something as small as an 8mm tumor, and he has history of heavy smoking, we want to know whether it's cancer or not. I can use CT to guide a needle right into the nodule and take samples of it. Or if someone has a mass in the belly that we don't know where it's coming from, or maybe that patient had a history of cancer and we want to know whether or not the cancer has come back, we can also do it either using ultrasound or CT. That is probably the most common thing that I've been doing.
Carrillo encourages patients to do their homework, and once an open surgery is suggested, they can investigate further as to whether interventional radiology may be an option for their treatment, especially since it's available right at the KHMH.
I have always wanted to come back to Belize, and I know that there is a need for it. Right now we're just starting, but eventually I think in medicine, everything will be this way. This is the way to go, right? And although we only have about 400,000 people, I think there is enough patients that we can work with. especially being here at the KHMH, that we get patients from all over the place, right, in the entire country.